dive in. My colleagues are Monika Górska, she's from Adam University as well, and Taubner from Heidelberg University is a supervisor of this project. So I will talk about the role of attachment and different aspects of mentalizing in dimensional diagnosis of personality disorders, so in DSM-5 AMPD measure, and I will try to focus on the relationship between our results and TFP, just to give a context on that. And fortunately, all of my introduction slides were already discussed during the lectures. So, why to study dimensional diagnosis in the context of transference-focused psychotherapy? I think it's obvious now. We have a great literature on the relationship between new AMPD models and CFP, the model of diagnostic models. So I will not focus on that, but I personally think that every time we study AMPD, we get to know a little bit more about our patients in a clinical context as well. Why study mentalizing in light of TFP? We have a vast research and clinical perspectives already discussed in great papers and great research. So I won't discuss that now, but we know that mentalizing has significantly enhanced the understanding of the key mechanisms of change in treating borderline and personality disorder patients. So it may serve as a predictor of change, as a mediator, moderator probably, and as an outcome that changes during TFP psychotherapy. And we have a great research on that, as you can see. Same as attachment, it is a key factor in TFP psychotherapy. We have a research on that as well that shows that if we facilitate attachment changes from insecure to more secure patterns, and we have a great clinical comments that says that it's always good to know where are our patients when it comes to attachment anxiety or avoidance, or somewhere in between, or maybe disorganized, because it says something about transference patterns, for example, that we can observe in our patients. So that's the rationale for our study. What about data? What data says about research on mentalizing and AMPD in DSM-5? As for criterion A, we have some research, and they say that there is a very strong association between mentalizing and personality functioning. There is studies that says that they're partially overlapped, that the correlation is very high. But there is also studies, as you can see, that show that there is limited or even no association between mentalizing and criterion A of AMPD. So our idea was that what is missing here, it's maybe the fact that mentalizing is a multidimensional variable, and we're supposed to look deeper into what mentalizing is being measured in this research, so that there is clear differentiation between in assessing self versus other mentalizing was not stated, and is often lacking in those research. The situation is a little bit more complex when it comes to mentalizing and criterion B, because we actually have no established theoretical models that would link mentalizing with criterion B maladaptive personality traits. But we have at least one research which I'm aware of so far by Erika Balcooper, and she and her colleagues did not find any main effects of mentalizing on any of 5 maladaptive personality traits. She did find also, although the moderation between that mentalizing was a moderator of the relationship between attachment avoidance and negative affectivity. So, but regarding criterion B and mentalizing, we have very limited research, and they're obviously not assessing that different forms, different aspects of mentalizing in terms of their self versus other mentalizing. And there are no studies on mentalizing and criterion A and criterion B and attachment insecurity in one study. So that's why I'm here to tell you that we wanted in our study that I will present, we wanted to examine how mentalizing relates to AMPD, both criterion A, so a level of personality functioning, and criterion B, so 5 of the maladaptive personality traits. With a focus on different phases of mentalizing, we chose self and other mentalizing, but we have in mind that there are also another dimensions of mentalizing, and probably next paper will be about that because we have the data on that as well. And insecure attachment as an important contextual factor of the relationship between mentalizing and personality pathology. So we posed 2 questions. First one was how different facets of mentalizing relate to AMPD criterion A and B. And the second question was, and we addressed this first question by regression analysis that I will show you in a minute. And the second question was, are there any moderating effects? Does mentalization moderate the relationship between the link between attachment insecurity, so attachment avoidance and anxiety, and criterion A and B? Why we pose those questions and why we think that it's important? I believe that we already know that mentalizing is important in personality pathology, but we will have a little bit more information of why it is so important, how it relates to borderline or personality pathology at all. These are our participants and our procedures, sorry, just participants. So we enrolled 109 participants from both from local community and psychiatric sample because we wanted to capture the whole range of pathology, of personality pathology, which is underneath the symptom. And you can see that it was a very heterogeneous group when it comes to SCID-5-PD categorical diagnosis, because less than, it's like 46% of our sample has no personality disorder diagnosis as assessed by SCID-5-PD. But most of them had at least one diagnosis, and almost a quarter of the sample had more than 2 or more diagnoses, up to 5. So the comorbidity of the categorical diagnosis was really high, with the borderline and obsessive compulsive and avoidant personality disorder as the more prevalent. Our group has, the mean age was 25. We enrolled participants till 18 to 47 years old. And these were exclusion criteria. We used for DSM-5 AMPD, for criterion A, we used self and interpersonal functioning scale. This is a questionnaire by Dominique Gamache. And for criterion B, personality P5, personality inventory for DSM-5, White Kruger. For mentalizing, we assessed self-mentalizing by the reflective functioning questionnaire by Fonagy and his colleagues, and other mentalizing was assessed by a movie for the assessment of social cognition by Jobek, and attachment by questionnaire ESPCR. Experiences with close relationship scale. And what are the results? As you can see, the question 1 was about how mentalizing relates to criterion A and B. You can see, here is self-mentalizing. So this is only self-mentalizing, this line. This line is about other mentalizing and different facets of other mentalizing. So you can see that self-mentalizing is constantly a predictor of all personality dimensions. So for criterion A, self and interpersonal functioning, and for all of the 5 maladaptive personality traits. Here you can see adjusted R-squared, so the percent of explained variance is like 55% for self, functioning, and 52 for negative affectivity, and the lowest is 18% for detachment. Yes. So this is the self-mentalizing, but other mentalizing is a predictor only for interpersonal phase set of criterion A of AMPD. So no criterion B traits and no self functioning in criterion A. So yeah, and this is the results of moderation analysis. We found a couple of significant moderations. So in general, we can say that mentalizing moderates the relationship between attachment and personality disorder. So better mentalizing acts as a buffer against changing the relationship between attachment, insecure attachment, and maladaptive personality traits, and for mask, so mentalizing about others for the relationship between attachment and criterion A interpersonal functioning. In general, we can say that mentalizing about others reduces the effect of attachment avoidance on detachment, so one of the big rules of the maladaptive personality traits. And mentalizing about self reduces the effect of attachment anxiety on both negative affectivity and detachment. So this is the difference here. Mentalizing about other is about avoidance, and mentalizing about self is about anxiety. Here is one of the examples of the moderation that we had. So you can see the black line is good mentalizing. The blue line is worst mentalizing, lower mentalizing. So we can see that mentalization changes the strength of the relationship between attachment and attachment, insecurity, and maladaptive personality traits. So when you are a good mentalizing, you have a chance, at least when you are less anxious, to be less detached than when you are bad mentalizing. When you are bad mentalizer, you have almost no chance to be lower and detachment level. So it's the same for negative affectivity. Okay, so let's jump into the conclusions. So to sum up, how mentalizing relates to personality pathology. For question 1, so the relationship between mentalizing and criterion A and B. We might say that self and other mentalizing relates to personality pathology in various ways, and that deficit in self-mentalizing is crucial as it is a unique predictor for the criterion A and B in an AMPD. Other mentalizing is less important, at least in other parts of personality pathology, because it relates only to interpersonal functioning from criterion E. And for question 2 about moderation effects of mentalizing, the way attachment influences negative affectivity and detachment, so those two personality traits were shown to be in this moderation effect. It depends on the level of mentalizing deficits. And for anxiety, insecure attachment, anxiety attachment, the self-mentalizing is more important as a moderator, and for avoidant attachment, it is other mentalizing that is important. What about clinical implications? Of course, we are very cautious about any implications of this study because it's just a cross-sectional studies on very heterogeneous samples. So we need to further explore these preliminary findings in psychotherapy, more process studies, and in other samples, maybe in more in a bigger group. But we can say that mentalizing for sure is strongly related to personality disorders, both the severity of personality disorder and the flavor of personality disorder. So both of the level of personality functioning and maladaptive personality. But probably it's not just anything that matters, because maybe self-mentalizing is more important, and it relates to the vast so many different dimensions of personality functioning. So maybe therapists should prioritize improving self-mentalizing, because we know that that mentalizing helps build realistic self-other representations, and it's a way for further integration. So maybe it's better to address self-mentalizing first, and then it will further goes to mentalizing others. That's the idea. And we can say that improving mentalizing about others may target maybe only the interpersonal aspect of impaired personality functioning. And as for moderation analysis, that better mentalizing may reduce the negative impact of insecure attachment on maladaptive personality traits. And for that self-mentalizing is probably more related to attachment anxiety, and our mentalizing probably is more related to attachment avoidance. Okay. Thank you very much.